Hi, I'm Jenny Backus, Acting Assistant Secretary for Public Affairs here at HHS, and welcome to our 6th web chat on health reform. The Affordable Care Act contains some really important benefits for you, but we also understand that it can be confusing and there's lots of misconceptions out there. We created these web chats as a way to answer your questions and hopefully clear up some of the confusion. Since we first began our chats, we've discussed many facets of the Affordable Care Act. This week, we're going to focus on an important benefit for businesses and their employers, which the President announced yesterday. Will you still have affordable health insurance? And what about businesses who want to help you with insurance when you retire? Those are the kinds of questions we're going to hit today. We've invited you all to submit your own personal questions on this issue and others, and we've received hundreds of questions. If you want to submit a question during our chat, we encourage you to do it. Send us a tweet via Twitter, and our handle is @hhs.gov. Or you can always email us, and our email address is healthreform@hhs.gov. Please keep your questions short so we can get it answered as many as possible, and we may have to paraphrase them a little bit to save some time. So if we don't get to your question today, check out our website, healthreform.gov, and you might find your answer because we're trying to address as many of your most frequently asked questions there, with new questions and answers posted every day. So joining us to explain some of the benefits that we just talked about for businesses and early retirees is Kathleen Sebelius, Secretary of Health and Human Services, and Gary Locke, Secretary of Commerce. So before we start off on early retiree insurance, I want to just ask the Secretary about something that made news this morning. You sent a letter last night to governors and state insurance commissioners asking them to do a couple of things. Can you tell us a little bit about that?
Sure. First of all, I want to thank Secretary Locke for being here today. He's a great partner in this effort in outreach to business. We sent a letter to my former colleagues, governors and insurance commissioners, to tell them that when WellPoint Insurance Company withdrew their 39% rate increase in California, it was in part due to the finding of the California Insurance Commissioner that their calculation of why the rates needed to go that high was just wrong. They used a wrong formula. And so this was a letter urging governors in other states where WellPoint operates to look at their own rate filings, because I know that increases were filed across the country, to make sure that they were accurate, that their actuaries actually look at what the trend lines are, but also to remind insurance commissioners and governors that in some states, the authorities are already in place for prior approval. Insurance companies coming to the department looking at the rates, the numbers before a rate goes into effect. Or in California, where they don't have prior approval, the rate actually got filed, and it wasn't until the commissioner took some action kind of after the fact that the rate got withdrawn. So we want to remind folks that even in the new Affordable Care Act, it's assumed that states will do rate review. It's effective. It helps to lower the costs when insurance commissioners pay attention to what companies are filing, and that if they don't have the authority, we're hoping they'll go to their legislatures and get the authority to actually do the kind of rigorous rate review that's required.
Now, you're both former governors. You've talked a lot about how state-friendly this bill is. We're going to talk a little bit later in the show about high-risk pools, which is another issue that some of the governors are talking about. But this bill is not only state-friendly, it's business-friendly. So that's why we have our very first time today with Secretary Locke. Can you tell us a little bit about what the President announced yesterday when it comes to the early retiree reinsurance program?
Well, first of all, thank you very much for having me on your webcast. And it's always a pleasure to be with Secretary Sebelius. We work so well together as governors, and I think we've learned a lot about the needs of businesses within our states. And there's a lot of misperception about the health care bill that was passed. First of all, there are incredible benefits for small businesses to offer health care insurance to their employees. Contrary to the misperceptions, there's no requirement for a small business, a company with less than 50 employees, to offer health care insurance to their employees. No penalties if they don't. But if they do, they're eligible for huge tax credits to offset the cost of providing health care coverage to their employees. And another more business-friendly feature was just announced by the President yesterday, which allows companies to basically recoup some of the increased costs that they or their insurance companies would have to pay for the health care cost of their early retirees who are older than 55 but not yet eligible for Medicare. It's kind of a reinsurance program, and basically what it does is just says that some of the increased costs that your individual retirees might incur based on health care, whether for themselves or members of their family, if their families are covered by the company, that the federal government will provide up to $5 billion to pay for some of these costs. And that means it's going to reduce the cost of health care for these companies that offer health care coverage to these early retirees before they're eligible for Medicare.
Now, you worked on putting this together, right? And businesses like this provision, right?
Well, Jenny, what we see is that a lot of companies have people who retire before they get to 65, before they're eligible for the Medicare program, and then, might have a heart attack or might be diagnosed with cancer, very expensive illnesses. And in some cases, employers are really struggling to figure out if they can keep their retiree program in place with those rising costs. And I think this is an effort by the President and Congress to not only recognize that there are some high costs associated with this, but also wanting to stabilize the private insurance market, to keep people offering this kind of coverage to not uninsure early retirees, but to keep that in place, having some additional federal help for the highest cost claims, I think will help stabilize this market and is very helpful to business owners who are, I think, right now caught. They want to do the right thing. They want to keep insurance in place for their current employees and for their retirees, but as costs go up, they're trying to figure out how in the world they can do this. This is a help to stabilize that market.
Let me just say, I don't think everybody quite understands. This is federal dollars, right? The companies 100%. Don't have to pay for it.
It's $5 billion that's available from the federal government to offset the cost that private companies through their insurance companies would have to pay, or if they're self-funded, self-insured, that they would be paying directly. And it's an incredible, really very beneficial program, and the companies would apply for it, and then the federal government would reimburse, let's say, if the company self-insures, reimburses the company directly, or will go through the company to the insurance company, their primary insurance company.
Plans.
Yeah.
And it's really, I think, aimed at, again, those very high-cost claims. This isn't the everyday benefit, but recognizing that when you get to be 55, between then and Medicare eligibility, you're more likely to have health conditions than if you're 25. So to encourage employers to keep this coverage in place, and recognizing that there are some folks in that early retiree group who have expensive health claims and don't really have a place to shop on the open market, and so keeping this in place with some 100% federal dollars to help pay the highest cost claims will really be a help to business owners.
Now, when I was going through the questions, and we're going to get to some specific ones in a second, I was struck over and over again by my spouse is an early retiree or my husband died. Does this apply to spouses and other family members of early retirees?
It depends on the company or the employer's health plan. And so if the company provides the early retiree with health insurance, but also covers the spouse or the dependent, then that would then the claims of that entire family unit would be covered. And so basically what happens is that the insurance company, or if the employer is self-insured, they pick up certain amount of the first cost, and then it's the extra cost that the federal government will pick up, basically to keep the costs of providing health insurance fairly low, and really having the federal government step in basically like a second insurance company for the very, very high cost. And that way the employer will continue to have low rates, either charged by the insurance company or not have to pay so much, set aside so much for themselves if they self-insure.
And we know that about 180 million Americans have their coverage through their employer. So this is really helping that marketplace. It also is not only private business owners, but governments who provide coverage for retiree programs, labor unions. This is
or nonprofits, things like
right,
that. Yeah,
right.
just
So
about
it kind
any
of
employer.
across the
Just about
board.
any employer.
All right. Now, is this going to go into effect? Is this one of those ones, end of 2011? Is it a September? Or it's June, right?
It's June of this year. Applications will be out by the end of June, but the program, people can come and get information right now on the website, but there'll be specific rules ready to go by June of 2010. So this is one of the immediate deliverables. This will be some help this year.
In fact, it's actually being made available sooner than was expected, thanks to the great work of your department.
All right, before we get into specific questions, the very last question that's out there, because I've actually not seen it in today's questions, but in all of our other ones, can we just, again, clear up the misconception about employer mandates? We get lots and lots of questions saying, my company has to offer, whether you're a small business or a big business. Can you address that, or both of you address that?
Well, at least for small businesses, companies with less than 50 employees, there's no requirement under the Health Care Reform Act that companies offer health insurance to their employees. And no penalties if they also don't offer health insurance to their employees if they have less than 50 employees. But if they do, they're actually they're actually eligible for very large tax credits to offset the cost of health care insurance that they're providing, basically rewarding those small business owners who are doing the right thing and offering health insurance to their employees.
And there will be a requirement once the new market is set up for larger employees to either offer coverage or to pay into the government plan for subsidies that their employees may be receiving to go shop for insurance elsewhere. It's kind of a fairness deal. Either you can step up and help your employees get coverage, but if taxpayers are helping your employee get coverage through a subsidy, then you have to reimburse basically for that employee coverage. It's kind of a personal responsibility, employer responsibility piece, but it does not apply, as Secretary Locke has said, to small business owners, those with less than 50 employees, and that doesn't even include the 50. Do not include seasonal employees or part-time employees. So about 95% of small businesses really do not fall under the category of needing to provide insurance once the new market gets up and running.
And I think there's more information just for all of you out there on both of these programs on our website. So if you have some specific questions or you want to know how to apply for those tax credits, healthreform.gov has the information for you on there. Now let's go to some of the questions that you've been sending in. And we've gotten a variety today. A lot on this reinsurance issue, but also another issue that's been in the news, high-risk pools. So we'll start to take your questions now. And again, feel free to send questions in via Twitter or through email, and we'll try to get to them. Okay, we've touched on this a little bit, but Darlene wants to know, how does one apply for the reinsurance or the early retirees program? It's not really the individual, right? It's the business.
Yeah, the business makes the application, and it covers the cost of the extra insurance or the extra medical care, the high cost of medical care for the individual, the retiree, or if the employer covers the dependents and the spouse, then it would also apply to them. We cover most of the cost of that extra cost. And it's for costs started or incurred after June 1. But the employer makes the application, and then the reimbursement will go either to the employer if they self-insure, or eventually to the insurance company that provides the benefits for that company.
And I think the rules will be clearly out within a couple of weeks. We're talking, we're in early May, we're talking about starting this program for earnest in June. So healthreform.gov will have the specific information.
And actually, you're anticipating a little bit David's question. He says he's an early retiree. I'm 63 years old. How do I know that my former employer will apply for the benefits for early retirees? Do I have to do something, and are they required to do something?
I think a couple of things, David. First of all, your employer may or may not offer coverage. This is just for the employers who currently are offering retiree coverage. Secondly, individual retirees don't have to apply. This really is to help the employer, who is currently paying an employer share of your retiree insurance costs, helping them pay for the extraordinary high costs of some individual care. So retirees don't have to apply for anything, and actually nothing will come individually to the retiree. It's to help the employer keep that coverage in place.
Okay, so Gloria from Arizona has a question. So there are people whose companies offer these benefits. Gloria wants to know, I'm an early retiree who retired at the age of 62 but wasn't affiliated with a company. What can I do, and how can I get some benefits on this? So it doesn't look like this program applies to her, but there's some other things that may be coming or more in 2014.
Well, right now, Gloria is probably in the individual market. And if she has a pre-existing condition, she may be eligible for the new high-risk pool program, because so many people who are 62 who may be a diabetic or suffer, have had cancer, can't be insured anywhere. So there will be a high-risk pool that Gloria may be eligible for. Standard rate, and that application should be available about the 1st of July, depending on what state she lives in. But other than that, Gloria needs to then have some insurance coverage on her own until she gets to be Medicare eligible. This doesn't set up new plans for retirees. It really is aimed at helping to keep in place the retiree coverage that's there right now.
You mentioned high-risk pools. We have a bunch of questions from different people about high-risk pools. Some of them are state-specific, so I would encourage people to look at the website, because we've actually posted a list of sort of how people are doing things. But there's been news about the federal government running pools in some states, and then about states running their own pools or programs. Can you tell me a little bit about, what the goal was when you set this up?
Well, the law basically indicated that we should have this bridge strategy, a high-risk pool available for those individuals who currently have a pre-existing health condition and really can't get insurance in the private market. Step one was to really say to states, do you want to run your own pool in Utah, in Colorado, in Connecticut? And we'll give you some federal dollars to help do that, and we'll give you some technical assistance. About 30 governors and the District of Columbia have decided, yes, they want to run their own pools. In other areas, they said, no, we're really not going to try to put together a pool at the state, and we here at HHS will have a backup plan. So wherever you live in the country, there will be an available high-risk pool for people who have been uninsured for at least 6 months, who have some kind of pre-existing health condition, and those very specific rules will be out by July 1st.
There's nothing better or subjectively better about one or the other. It's just whatever works best for that state?
Well, a lot of states were running a high-risk pool already, and that's, again, what I would remind people, that depending on where you live, call your insurance department and ask if right now there is a high-risk pool available. There are about 34 states in the country that have current high-risk pools. This is an additional pool for folks who have not had insurance for at least 6 months. And again, we'll provide kind of an additional bridge strategy. When we get to 2014 with the new markets and the health exchanges, all the individuals we're talking about hopefully will have some affordable, available choices. But this is a step to get us there.
Okay, more funding questions. We had them about the early retiree reinsurance. Now Josh wants to know, won't the states give up federal money if they choose to run the program for high-risk pools?
No.
So this is, again, like early retiree reinsurance, 100% federal dollars?
It is 100% federal dollars. There is no state match, and the dollars have been allocated according to a formula that has been used to distribute other federal health programs, the children's insurance program. So states have a share of the money for the high-risk pool available to them. And if they don't choose to use it, we will use it here at HHS to help provide insurance coverage for individuals in that state.
Okay, Mary from South Carolina. Sorry, Secretary Locke. There's lots of high-risk pools.
This is a very important topic, and it's to cover those people. As a former
governor,
but it's to cover those people who right now have pre-existing conditions, who really cannot purchase health insurance on their own. And this is such a valuable bridge until 2014.
Well, Mary wants to know, and I think this is actually a lot of the questions that we've been seeing on the website from South Carolina. I qualify for the federal high-risk pool, but I live in South Carolina, where Governor Sanford declined to participate in the program. Does this mean that the federal program is not available to eligible citizens in our state?
In South Carolina, there will be an option available to you run by HHS. Whether we do it at a regional basis or state-specific basis, those decisions are still being made, but there will be an option for qualified individuals in South Carolina to participate in a high-risk pool.
Okay. I'm going to see, there's 2 more questions on high-risk pool, and then I want to just go back to some general questions about the early retiree reinsurance.
Governor Locke can just jump in here.
Exactly. Let's talk about, actually this is a question for both of you, which is when are some of the programs, Tom from Florida wants to know, when are some of these programs going to be up and running? What's going to happen this year with the Affordable Care Act? We talked about the early retiree insurance and high-risk pools. Small business, is there?
Well, for instance, right now, the tax incentives, the tax credits are available right now and are retroactive to the beginning of 2010. Again, small companies with less than 50 employees are not required to offer health insurance to their employees. If they don't, no penalties, no fines, nothing. But if they do, they're eligible for these tax credits that are retroactive to January 1, 2010. This is to reward companies for doing the right thing and offering health insurance to their employees. It's also a competitive issue. A lot of companies, small companies, offer health insurance to their employees. Their competitors don't. And so those competitors that don't offer health insurance oftentimes can charge lower prices for their services or their products. That's unfair. And so the federal government, through the Health Care Reform Act, is giving a financial incentive to those companies, rewarding them for doing the right thing.
We're in May, graduation time. Good news for a lot of families. Their children up to the age of 26 can stay on a family insurance plan. Lots of people have that situation where the child may be in the job market but not in a job that has health insurance. So that's good news. That hits this year. It's available, and companies are actually stepping up early and opening those plans up. This year, seniors who hit the so-called donut hole, the gap in coverage for prescription drugs, will get checks. Some of them will get a check in June if they've already been paying 100% out of pocket. Others in September. Seniors don't need to apply. We will monitor the billings here at Medicare and actually send checks to seniors. That hits this year. And the high-risk pools will be in place this year. The early retiree program, help for business owners, will be in place this year. And then a number of our preventive services hit this year. So plans will be offering preventive and wellness care without a financial copay that will help people get mammograms and cancer screenings without having to worry about, do I have enough money in my pocket to match the insurance company bills. So all of those go into place this year.
Well, you just said something that struck me, and I have 2 governors here, so I want to take advantage of having you both. You were giving some advice to seniors about don't give away your personal information. You both have run states. You've been an insurance commissioner. There's lots of misinformation. There's lots of scams that are happening out there. I know that the Commerce Department works with the Better Business Bureau. I know you've written some letters. What are some important messages that everyday Americans need to hear about the Affordable Care Act, and sort of some ideas about what they can do if they hear something that sounds just a little strange to them?
If it, I think the basic rule is if it sounds too good to be true, it's probably not true. And you know, come on to the HHS website, find out more information, talk to reputable organizations like AARP, talk to your other family members, consult other people before you make some decision to sign up for something, or somebody calling you on the phone, a telemarketer, or people knocking on your door. The same thing occurs with the census. The census this year has only 10 questions, and so if anybody calls and says that they need your Social Security number, need credit card numbers, or anything like that, it's not true.
Well, I think that it's important, the HHS website, healthreform.gov, is a great source of information. Our Medicare hotline, 1-800-MEDICARE, toll-free, get questions answered. As a basic rule, insurance is not sold door to door. So if somebody shows up at your door saying, have I got a deal for you, I think thank them, close the door, and then call somebody, because that typically, we will not be selling Medicare benefits door to door. We will not be sending people out to qualify people to get the checks for their prescription drugs door to door. Do not give Medicare information to anybody. It's very valuable. Your ID number on Medicare is very valuable. It's worth something, which is why people want to get it, just like they may want to get your Social Security number. Don't give it away. Don't share it. Don't lend it. And certainly report anything. We have such great help, Jenny, as you know, from seniors all over the country who are part of our Medicaid fraud patrol. We don't like folks who try to steal money from the Medicare system. We are getting very serious with the Attorney General and me working together under the President's direction to go after thieves and criminals. But having seniors be very alert and reporting anything that seems suspicious, somebody who's trying to sell something that doesn't sound quite right, somebody asking to, take your Medicare card. Reporting that right away gives us a head start, lets us go after the bad guys, and that's really helpful.
Well, that's great. We're going to have 2 more questions just came in, and then we're going to ask you for closing thoughts. So we're going back to the topic of early retiree reinsurance. Janet from California says, are only companies that currently offer retiree insurance entitled to the program? What if our company decided to start offering retiree health benefits? Would we be eligible at some point for the reinsurance program?
Yes, if the company is offering coverage for early retirees until 2014, this program is in place, it's again to really provide incentives for companies to continue to provide health insurance for their early retirees, and to basically reduce the cost of doing so, especially when a couple of those retirees may have very large health claims exceeding a certain amount. This government program of $5 billion will cover those extra costs above and beyond the normal cost, and that will keep the premiums low for that company, so that company continue and will reward that company for offering health insurance to their early retirees.
Okay. Barbara wants to know, and I think we hit this before, but we should probably just hit it again because it just came in. If an employer does not offer early retiree coverage, what are the other options out there for employees to get coverage?
Well, again, as Janet said, maybe the employer will look again, being afraid of 1 or 2 very high-cost cases may have kept them from offering retiree coverage. So this may be an incentive for some people to take a look at it. Again, in 2014, there will be a new market. A lot of people 55 to 65 are really struggling with where they get coverage right now, and the new insurance exchanges will be set up. But in the meantime, there may be a high-risk pool already operating in your own state. There's a new high-risk pool that will be in place to try and provide some steps toward Medicare or affordable coverage in 2014 with the new health insurance exchanges.
Okay. Well, last parting thoughts before we end for today. Secretary Locke, is there something that you've been talking a lot about this health reform bill? Probably not as much as my boss, but but out there talking about it. Is there one message that you want people to know since this law has been enacted about how their lives are going to change?
Well, I think that one of the important messages is that there are so many provisions of this Healthcare Reform Act that are going to really try to slow down the rising cost of healthcare. I mean, prices are always going up, whether it's milk or bread or eggs. And for a lot of businesses, they've seen rates going up by 30–40% every single year. No business can survive when health insurance rates are going up by that amount. And so the tax incentives, the actual tax credits, tax refunds or offsets in terms of what a company would otherwise have to pay by way of income taxes as rewards for offering health care insurance to their employees if they have less than 50 full-time employees. These are astronomical and of great benefit. And then, of course, the incentives with the $5 billion available from the federal government to pick up some of the extra costs, some of the higher costs of health care from early retirees. I think we'll reward companies for doing that and provide an incentive for them to continue to provide that health insurance for their retirees and keep that cost low. That's the whole point of this Health Care Reform Act. A lot of benefits for businesses.
Okay. And Secretary, you out there a lot, you get lots of questions. What's the one thing you want to straighten up for this week?
Well, I think that people have a lot of questions about the new bill, and we understand that, and they need to know we're working really hard, and in the not too distant future, within the next couple of months, we are going to have a call center available to ask questions and get answers on a very regular basis, and some web information which will be easy to access and easy to use. I know people are anxious to have that. Right now, we want to make sure we get the right answers put together before we actually launch the call center, get some people trained, get them up and running. But that's coming. And in the meantime, tune into the web chats, go to the website, healthreform.gov, or if the questions are about Medicare and advantages that will come about because of the bill that will help Medicare-eligible citizens, go to our 1-800-MEDICARE number. Good information available. We're trying to get as much out as we can because there's a lot of good news coming folks' way.
All right. Well, I'd like to thank you both for joining us today. Kathleen Sebelius, Secretary of Health and Human Services, Secretary Gary Locke, Secretary of the Commerce. We hope we got to most of your questions today, or at least those that are applicable to you. If you want to go back and review today's show or pass it along to a friend, we'll make this web chat available on demand, and then we'll archive it on the website, healthreform.gov. We hope you continue to browse the site to get all the latest information or track down something that's specific to your needs. I'm Jenny Backus, and we'll be back next week with another web chat on health reform. Hope to see you then.